Well, hello, everyone, and welcome to Health Chats Among Friends. My name is Deidra Kindred. I'm a nurse advocate, educator, and navigator. And tonight I have my good friend returning, Cheryl Gray Coat with ArcPoint Labs. Say hi, Cheryl.
Hi. Good to be with you, Deidra. Thank you so much.
Thank you. Thank you for returning because you always have some great tidbits of information. Cutting edge technology is always fun. So tonight, we wanted to have you back to talk about a few of your updates, and then we can have you back again to talk about more of your updates because you have a lot of things going on. But first, I'm going to be quiet and have you introduce yourself the way you want to introduce yourself to the audience.
I'm Cheryl Gray. Thank you so much for having me. I am a veteran of the medical industry. With over 35 years of experience in medical. I've witnessed that as well in my own personal life. I had a husband that was paralyzed and took care of him for 2 years. So I've been on both sides of the fence. Like you're an advocate for patient care. I know what it takes in the medical field to try to take care of people and to have those constraints as far as insurances go, what your limitations are for care, but being the patient or the patient caretaker, knowing what you need really to provide good health care. So I try to balance those in the way that we operate our business at ArcPoint Labs. And I absolutely love what I do.
I can tell, and thank you for your service on top of all that. Right? So yes. You had mentioned something earlier when we were talking DNA and pharmacogenetics.
Yes, so ma'am.
Let's talk a little bit about that.
Well, pharmacogenetics is not only a hard word to say, but it's a fantastic DNA test. So there are over 100,000 adverse drug reactions that happen every year. We go to the doctor and we describe to them the different things that are going on with their body. A lot of times their first go-to is let's prescribe something. And then they give you pills and they ask you to come back in 2 weeks and tell you how you're feeling, how did it help? But your body metabolizes according to what your DNA is. And there's 4 different ways that our bodies can actually metabolize medications. And those medications we actually may be allergic to, or they cause, just a little bit of a change. Sometimes those allergies can actually cause us the need to go to the emergency room. It can even cause a death. So having the pharmacogenetics test, it's just a cheek swab. So we take a cotton tip and we rub inside the cheek, and then we send it off to the laboratory. They analyze that and they give you a breakdown of over 300 different medications, and it's in every category. So that can be for cardiology, that can be for endocrinology, for urology, for any kind of category that you would be taking medication, to let you know which ones are safe for you to take. So it eliminates the question of taking a drug that you could have an allergic reaction to. So we've been able to help. It's just fantastic. We've been able to help a mom with a child that was autistic, taking quite a bit of medication. They couldn't get to where they needed to be to actually get this child, in the right direction. So coming back and having pharmacogenetics to find out what medications really did work with the child's body actually put him to better health. So not only preventing, but finding the better medication that will help with whatever it is that you're dealing with. It's fantastic.
Oh, this is amazing, because we could have did this whole podcast just on this right here. So absolutely. When should someone ask to have that test, and do we have to have a doctor's order for it, or how does that work?
Actually, you don't have to have a doctor's order. That's a great question, Deidra. So everything that we do in this is individual can walk into our office and say, I'd like to have a certain test done. You don't have to have a doctor's order for that, but if you wanted to claim on your insurance, then you would have to have a doctor's order. So you can private pay out of your pocket for a test. We do have a clinical authority. So Dr. McAlpine is our clinical authority at the office. Anything that would come back as a laboratory report, he would review and offer his service to actually go over with the patient. But so to go back to your question, when should someone ask for this test to be done? If they're taking medications now and they're actually not getting the relief that they feel like they should be getting, come in and let us do this test for you, so that not only are we testing to see if the drugs you're able to metabolize properly, but we're also looking to see, and you'll appreciate this, we're looking to see if medications that you are prescribed, maybe from a heart doctor, and other ones that you're prescribed from an endocrinologist, maybe they're having a contraindication. So we can find out about that. And the report is a lifetime report. So your DNA is not going to change. Your metabolism is not going to change. So we just find out what type of metabolizer that you are. We can show you the drugs that will be safe for you to take. And then if you're currently on a prescription of multiple drugs, they can tell you what times that you should take the certain medications so that you don't have an interaction with the drugs that you're already on. Does that make sense?
That makes a lot of sense. So my next question is it very expensive for this type of testing, or?
Unfortunately, it's about $495 for that test. So we can help. We can help by actually splitting. I'm sorry?
I was getting ready to say it's probably worth it, because when you look at the grand scheme of things, if you have an allergic reaction, that's thousands of dollars. Whereas this one would be is it a one-time?
It is. It's a lifetime test. So once you find what kind of metabolizer that you are for medications, and again, the report will give you a list of medications. It's over, I believe it's over 290 medications that actually are on. Yeah. So it's a fantastic report. Again, you'll find out what type of metabolizer you are, so you can take it to your doctors, and then they will know medications, because their pharmaceutical representatives will actually be able to tell them this is this type of metabolizer. So it's very helpful to know.
Well,
the information is fantastic.
Yes, I like the fact that you are not only saying, okay, these drugs you may not be cohesive to your body. I was trying to think of a word, but these are some drugs that could be substituted instead. I think that is amazing. Oh, my brain is just clicking. Okay, well, awesome. I want to spend more time on this topic, but we have a couple other topics we wanted to talk about. Maybe we can have you come back and do a series.
I would love to. Yes, I believe that I have a slideshow. Yeah, absolutely.
Oh my goodness. This right here, this pharmacogenetic DNA test, with the DNA testing, that's phenomenal. I can't get over this one. Yeah. Wow.
Technology is amazing, isn't it? So great.
Yes, because you never know, because your body, you could be taking something for years and you're having these side effects. They may be caused by the medications that are supposed to help you, or they may not be. You may not just be metabolizing them right, or maybe you need a different med or something else, because it's so much in different medications in different categories. Because someone asked me, because they were looking at their lab values for their kidney function. And they were asking me, why do they put African American separate, if you're separate? And I said, because African Americans have been known to process and metabolize certain groups of drugs, like the prils, different than other people. And that's all in genetics.
That's
That's
exactly right. Yeah.
epigenetic. So wow, I mean, we could do a whole podcast on this, but I'm gonna go keep moving
I
on. I
know.
got excited.
Well, it is. It's dear to my heart, truly, because I had a grandfather that passed away. He had gone to the doctor earlier in the day. The doctor changed his blood pressure medication. My
Mm,
mother took him to, to the pharmacy to get the drug filled, brought him home, gave him the medication, and actually before she even got home, my grandmother called and he had passed away from the medication. Yeah, I mean, so you never know what can happen,
mm.
and it's better to be safe than sorry.
And it one
So
size,
insurance is.
mm, and
Yeah.
one size doesn't fit all. So I'm sorry, I have to spend a little bit more time on this one. So let's say your insurance, you would have to get a doctor's order, and your
Yes.
insurance, would you get the doctor's order from your PCP, your cardiologist, your renal doctor? What?
Um, well, you could probably get one from your primary care physician if you actually are taking medication. Whoever's prescribing medication for you should be able to give you that prescription. I'm not going to say that insurance is going to cover the entire amount of it. But again, what we can do is actually do private pay, and they give you a receipt so that you can turn it in and insurance do a reimbursement for you. So.
Right. Because I'm almost apt to say if you have more than 5 medications,
Mhm.
you probably need this testing. And I can think of a lot of people, but I was trying to see how to get that process rolling for them. Do many doctors know about this testing?
There's a lot of doctors actually. Now think about this. In for therapeutic drugs. So drugs for anxiety, drugs for depression, different drugs like that. A lot of the therapeutic doctors will actually have this done so that they can make sure that you're not going to have an adverse reaction to it. So we see a lot of it from that angle, but it's also very, very helpful, especially with the heart drugs, with the blood pressure medications. So it's useful in all aspects, truly.
Wow. I mean, this is amazing because most of the clients that I know, they have these endocrinologists and cardiologists and pulmonologists and renal doctors. And it's like,
Yeah.
whoa. So do you have, I mean, I'm sorry, I just took up the whole podcast on this one. I'm sorry.
No, it's okay. Yeah.
So do you
Well,
have
this plays
any?
right into your
Yeah,
help too, because you're trying
yeah.
to actually wrap. Yes. Yeah.
Absolutely. If I could somehow get some of my clients to take this test, I think it would be amazing because every time some people, when they go to the doctor, here's another medication that they're writing, because something else caused something else that caused something else, and it's so like
Yes.
a spiraling ball, and you don't feel like you're ever getting well. You feel like all I'm doing is taking medication. So I feel like, I'm sorry, I'm gonna apologize to the audience. This whole podcast is probably gonna be about this
Okay.
because this is such a huge topic, and we just have, that means we have to have you back for the other ones.
Okay,
No,
very good.
no. I just changed my mind. It's okay. We're gonna go into serum tears because it is allergy season.
Yes.
And then you wanted to so we're gonna stick a pin in pharmacogenetics, and we'll probably have to have you back for that one because that's a huge topic. And
Okay.
so serum tears, what's serum tears?
Serum tears is, it does need a prescription. So again, anyone with severe dry eye, and we see that in anybody that's had any kind of eye surgery. So if you've had cataract surgery, myself, I've had LASIK surgery, it causes a severe dry eye problem. So there's lots of stuff that you can take that are prescription drops or over-the-counter drops, but we are made fearfully and wonderfully made. God has made our bodies to actually heal, and your own tears are your best healing medicine. So what Serum Tears is your doctor can write a prescription for you. You bring it to us. We do a blood draw. So we will take blood from your arm. We spin it down in the centrifuge. And when we spin that down, the serum actually rises to the top. We'll separate that serum, pull it off, and actually mix it with saline according to what your doctor's prescription is, and then put it in the eye drop bottles. And you're able to use those eye drops, again, according to the prescription. But if this myself, because I've had the LASIK surgery, so I use this myself, and it's just, it's glorious. I'm telling you, you put that in and it just soothes your eye. It's cooling to you. And the drops actually last for about 6 months. It's $179, which is not that much when you consider it's a 6-month supply. I don't know why my face is on the screen, but
I don't know. I lost your photo for some reason.
Yeah. Anyway, so it's a wonderful product. I highly recommend that, especially for allergy season. We had quite a few people coming in last week trying to get their refills. Lots of Serum Tears going out right now.
Oh, wow. Wow. Okay. That's not because you're getting your own natural liquids back, or your own serum back. That's awesome.
Yes.
So there's no,
It is
hardly ever any interaction because it came from you.
That's correct. Yes, we're taking directly from your body, mixing it with saline. Some doctors actually will use the serum in a straight 100% solution. So it's all serum if, the need is there for the patient to have a deep healing.
Wow. Wow. Okay. Wonderful. And that leads into another topic, these people who are unfortunately underinsured or uninsured. How do you guys help with that, alleviate that stress?
Well, we're actually a collection facility. And so we are partners with clinical pathology laboratories. We're also partners with Quest laboratories. So we're not the big laboratories. We're privately owned, obviously. But we like to offer discounted pricing to the people that are underinsured or uninsured so that they can have their laboratory work done at a reasonable cost, something that's affordable to them. The last thing that you want to do is wait on your health. If you feel like there's something wrong, then, by all means, let's come in and let's take a look at it. Again, we have the clinical authority, Dr. McAlpine. So he's able to look over it, read those, and give you his thoughts and refer you to someone if you need to be referred for a review.
So if you do not have any insurance and maybe you haven't had your yearly set of labs, is that something you do, or what type of labs do you draw for?
We have all different kinds of programs. So we have a weight management program. We have a hormone panel. We have a thyroid panel. So if somebody's just really tired and wants to know, why am I feeling so tired? Maybe it's because of the thyroid. So we can do the thyroid panel. We have an STD panel that it covers all STDs. Just a main comprehensive health, just to take a look at that. And I think our comprehensive health panel is like $250, but it covers head to toe. It has your lipids, it has the CBC, vitamin D, everything top to bottom.
Oh my goodness, you were doing some amazing, amazing things. And we don't even have time to go into the other topics, but we will definitely have you back to go into those other topics and maybe do a separate on pharmacogenetics. I have I have so enjoyed this. I've been taking notes and I appreciate your time. If someone wanted to find out more about the pharmacogenetic testing with the DNA,
Yes.
if they wanted to find out more about the serum tears, especially during this time of year, or they don't have insurance or they're underinsured and they want some labs done because they want to stay on top of their health, what is the best way for them to reach out to you and find out more information?
Deidre, our phone number at the office is 817-928-4915. I'm happy to talk to them anytime. Please feel free to ask for me specifically if you want to discuss any of that. You can talk to any of our representatives at the office to help make an appointment or give you some general advice. But I would love to hear from you personally, especially if they're working with you, because I know that you're just absolutely fantastic. So I'll give you as much information as I can. And we want to help everybody to where they feel better and they know they have the right information to take the drugs that they need to take.
Oh
Okay.
my goodness, that's so huge. Oh my goodness, huge. I'm excited.
Yeah.
Well, thank you, Cheryl, for your time,
Yes.
for your knowledge,
Thank you.
for your willingness to share with us in the audience. And thank you, everyone, for tuning in to Health Chats Among Friends. My name is Deidra Kindred. I'm a nurse advocate, educator, and navigator. And I love bringing you reputable resources from our local communities. Tune in next week for another amazing guest and some more amazing resources. Thank
Thank
you.
you, Deidre. Thank you so much.